doing a lot of inner child work and I just like can't engage in your negativity right now.
You're love bombing me, Oppenheimer.
Thank you so much for communicating that with me, but I'm actually trying to leave the inner people pleaser in me behind. So no, I will not be doing the dishes.
Did I just trigger you? Did I overstep your boundaries by playing those videos? Maybe you've had a similar interaction with someone in real life who weaponized common words used in therapy in order to put you down. This is what is now referred to as therapy speak, and it's getting in the way of how we handle conflict, both in platonic and romantic relationships. Does this mean all this therapy talk is just vapid semantics all the time? No, the answer, especially when it comes to this topic, is nuanced. So let's try to pinpoint where this trend began, the consequences it's having on us, and what we can do to stop it. Let's think back to life before the scientific method. Imagine you're having a tough day. You just finished tilling the farm and your wife ridicules you for taking too long. You're reminded of the verbal and sometimes physical abuse your father would give you, but you don't really think about it in that way. Instead, you probably vent about it to your friends or try to find answers in your religion, and you end up exuding the same behaviors that your father did to his children and his wife because you don't know how to put a name to what you're going through. In a lot of cases, that guidance from your friends or religion may have genuinely helped you to the point where you actually didn't become a deadbeat dad. Obviously, people were able to get through childhood trauma before modern medicine and diagnoses, but the general solution was more so just figure it out or suck it up. As a result, I do think more people were less aware of their unconscious behaviors and where they came from, which in many cases results in people close to them getting hurt more. And if you went to war and experienced PTSD from it, you were basically screwed for life. Then we fast forward to the early 1950s. Breakthroughs in science are being made. The first effective antipsychotic drug, Thorazine, dramatically reduced psychotic symptoms in schizophrenia and mania, allowing many of these long-term patients to be discharged for the first time. In that same year, what could be seen as the manual that kick-started therapy speak was born. The first edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-I for short. The first edition of the DSM was still heavily influenced by psychoanalysis, the theory of mind popularized by Freud. It was all about what was going on in your environment and unconscious mind back then. Schizophrenia was characterized as a reaction rather than the neurodevelopmental biological condition influenced by genetics and environment that we see it as today. And anyone that was ineffective at coping with life's demands without exhibiting any clear mental illness symptoms was labeled as having inadequate personality, whatever that means. As you can see, we still didn't have a firm grasp on the mental landscape, even with scientific tools, but in the 1980s, that began to change. When the DSM-III was published, it was widely accepted by clinicians and researchers. It broke away from the speculative nature of psychoanalysis and described disorders based on reportable, observable symptoms. Each disorder now had specific standardized symptom lists with time frames and exclusion rules, forcing psychiatrists to consider biological, psychological, and social factors together. Because that's how we really discern the nuance of mental health. It is nearly impossible to isolate any disorder to a singular cause or symptom. You have to consider all of these factors if you want the most accurate picture. So when we detach these terms from their clinical meaning to belittle others and ruin our relationships, that's when shit starts to hit the fan. But it'll be better to reinforce this point if I give actual examples, which will come up later in this video. First, I want to tell you guys something. You know by now, a lot of my topics on this channel are centered around a lack of critical thinking skills in modern society. For example, it's either all therapy is bad and useless, or everybody needs therapy and everyone needs to talk about their traumas and process them all the time. That sort of black and white thinking is all too common because critical thinking takes more work. Our attention is increasingly fragmented, making it nearly impossible to slow down and think deeply about what we say to others and the decisions we make. That is why I made my Critical Thinking Masterclass. It's a 16-video curriculum designed to help you learn emotional regulation, spot misinformation, and make better decisions in every area of your life. The Masterclass teaches you how to look for the nuance and see when you might be being biased so you stop making decisions you regret in the future. Since I learned what I teach you in the Masterclass, my relationships, finances, and mental health have all improved significantly. I stopped getting angry at every comment that doesn't agree with me, I don't make as many poor decisions, and I'm much more present and intentional with my actions. If you feel like the modern world has left you confused, emotional, or made you say or do things that you wish you hadn't, then you can check out the masterclass by clicking the first link in the description. And the first 100 people to use the code LAUNCH10 at checkout are going to get 10% off. Hope to see you in there. The acceptance of the DSM-III in clinical settings undoubtedly produced a net positive on society. PTSD's inclusion gave legitimacy to veterans' experiences and opened new legal, medical, and therapeutic frameworks. Eating disorders were introduced as distinct diagnoses, which justified insurance coverages for inpatient treatment. But here's the thing, especially with more broader terms than the examples I just used. Labels can often be a double-edged sword. On the one hand, without a proper name and classification of certain conditions, they're next to impossible to treat. In this way, labeling is often necessary if we want to create some sort of replicable method for treating people who all exhibit similar behaviors. And that results in more people getting better. But on the other hand, as much as we've gotten a lot better at identifying certain conditions, it can often be difficult to get a patient to report their symptoms with 100% accuracy, especially if that patient isn't actually a patient at all and isn't working with an expert to identify what they're going through. And that's exactly where the modern problems of therapy speak spawn from. When these sorts of labels and disorders slowly drift away from the clinical field and into the hands of anyone with a large influence who appears trustworthy, all of a sudden you have large groups of people self-diagnosing or misrepresenting the intended definitions, applications, and solutions of the mental health field. The examples from the intro are obviously a bit exaggerated, but they are pretty close to portraying the archetype of someone who is deep in the rabbit hole of pseudopsychology and self-proclaimed high emotional intelligence. One of the biggest contributors to creating these types of people are these 5 signs you might have X content. An influencer who may or may not have a clinical background starts listing off common symptoms of people who have the condition or disorder. Many people watch these sorts of videos and think, oh yeah, I've been feeling empty or numb even though everything seems fine from the outside. Maybe I do really have high-functioning depression. And they let that label define them and their actions without actually doing anything to verify if their feelings match with a proper diagnosis. The reason why the latest edition of the DSM-5, is so widely accepted amongst professionals is because it has a checklist of required symptoms, plus rules for how long they've been present, how severe they are, and what else needs to be ruled out. This is an extensive process of clinical interviews, collateral information from family, teachers, or medical records, and screening tools such as structured questionnaires. Not a TikTok from a random person just listing off symptoms. Now, if you use this TikTok to seek out that process for yourself to see if you actually could be diagnosed with something like major depressive disorder, that's a different story, but that's not what a lot of these people are doing. This is how inaccurate surface-level definitions for clinical terms like narcissistic personality disorder or PTSD get hijacked to explain why we did something mean or rude to someone, or why someone else did that mean or rude thing to us. And I think a really good example of someone misrepresenting a term commonly used by professionals was the whole Jonah Hill surfer ex-girlfriend scandal from a couple years ago. Basically, his ex-girlfriend Sarah Brady accused Jonah Hill of emotional abuse, to which he denied, which prompted her to post these screenshots to her Instagram story. Jonah insisted she remove any pictures of her in a bikini on her Instagram, and she did. But what's really important to focus on as it pertains to this video are these texts about boundaries. If you need surfing with men, boundaryless inappropriate friendships of men, to model, to post pictures of yourself in a bathing suit, yada yada yada, I am not the right partner for you. These are my boundaries for a romantic partnership. My boundaries with you based on the ways these actions have hurt our trust. I'm not here to argue about whether this is emotionally abusive or not. It's normal to have standards for what you can and cannot put up with in a relationship, like the actions your partner do, and communicating that early on in a relationship is important. Honestly, if he would have just stopped the text messages at, "then I am not the right partner for you," I would have said, okay, that's totally reasonable. The biggest problem comes with the phrase, "these are my boundaries," which is a misuse of the term. A boundary is a limit someone sets for themselves to protect their well-being. It is a set of guidelines for what someone will put up with in terms of how people behave toward them and how they'll respond when someone passes those limits. In the message Jonah sent to Sarah, he is not setting boundaries because the behaviors he's describing aren't directed toward him. That's the key nuance here. If Sarah was intentionally posting promiscuous photos to get a rise out of him, then maybe that term would make sense here. but he's dictating her behaviors and what people she can hang out with. Now, we don't have all the details, of course. He could have made that clear very early on in the relationship, and she kept crossing that line. And if that was the case, he could have said something like, "This is consistently bringing up problems in our relationship. I don't want to be with someone who does these things, so I don't think we're compatible." And that would have been a totally valid response. But that's not what he did. He tried to control her behavior and make her take down photos and command who she could and couldn't hang out with, then spun it as her crossing his boundaries to make himself seem like a victim. This is the consequence of making therapy terms widely accessible and turning them into easily digestible social media style formats. People misdiagnose themselves without seeking professional help, terms get misused as ammo to fire at the people they're close to, and the original meaning of those terms erodes. What were once precise clinical concepts become catch-all labels stripped of context and used to validate any feeling or justify any behavior. Over time, this not only dilutes their usefulness in real therapeutic settings, but also fosters a culture where self-diagnosis replaces assessment and where relationships suffer under the weight of weaponized therapy speak. The biggest culprits of these offenses are really the people I described at the end of my Why Gen Z is Terrified of Intimacy video. The kinds of people that say they're exercising their boundaries whenever any sort of uncomfortable conversation happens or someone gets too close and they need a justification for why they ran away. The same people who accuse partners of being narcissistic the moment they express a need or frustration, turning any disagreement into a personality disorder diagnosis. Or the ones who label every instance of miscommunication as emotional abuse, making it impossible to navigate normal relationship conflict without one person feeling pathologized. Ironically, it's these types of people, the ones that take advantage of therapy terms and warp them into trendy surface-level meanings, that could greatly benefit from therapy themselves. There's this really good Bustle article titled, "Is Therapy Speak Making Us Selfish?" which explains some of these scenarios playing out in real-life situations. In one story, a 29-year-old from Kentucky had a friend who repeatedly insisted on dictating meetups in the name of self-care. When we would make plans, they would try to change them the day before, she says. Trying to reschedule and rearrange events would be met with, "The plan is changed. We're going to do alternate activity. I'm setting a boundary." If Lucy tried to protest, she says, her friend would accuse her of being pushy, which ultimately made her reluctant to make plans out of fear of coming off as demanding or toxic. It did make me doubt myself and think that I was being needlessly demanding or making people uncomfortable by expecting plans to be upheld, she says. I still get that knee-jerk reaction of not wanting to be a bother when plans are canceled. That's the type of shit that I'm talking about. Within that article, professor and psychologist Marissa Franco says it best. Encouraging people to set boundaries in a way where you're only considering your needs and not someone else's can hinder creating healthy relationships. It's antithetical to this assumption we all have in our relationships, which is that when we're in need, someone will show up for us. That's what makes us feel secure with someone, that we can trust them to show up for us in times of need. This is part of the reason why creating relationships feels so hard now. Boundaries in their healthiest form are supposed to create space for both people to feel safe and respected. But when they're used as a way to control the terms of every interaction, they chip away at the reciprocity that relationships are built on. See, the purpose of therapy and putting labels on your emotions and growing awareness around them isn't to start letting more people out, it's so you can get to the point where you feel comfortable enough to start letting more people in. To get more comfortable with being uncomfortable, with the disagreements, with knowing when to say yes to that outing with friends to make them happy and strengthen your friendship, even though it might make you a little tired, versus a time where it actually makes sense to say no. With stepping back and genuinely considering what you said to someone that they claimed hurt them instead of immediately dismissing it as their problem because they're not as emotionally intelligent as you are. We've come a long way from just telling people that they're either insane or they need to suck it up, but it's come at a cost that doesn't need to be exploited the way that it is right now. If you think the symptoms being illustrated in a short-form piece of content match what you're going through, then please seek out a professional if possible before accepting those symptoms as absolute truth. And if you feel some sort of discomfort or ridicule when you're with a friend or romantic partner, yes, you should communicate it, but not in a way that only centers it on your needs while you bend the definitions of genuine boundaries, abuse, or toxicity to justify shutting the other person down. Healthy communication means considering how your words and actions affect the other person, not just how they serve your own sense of comfort. And if the younger generations have any chance at fixing this lack of trust, friendship, and romantic involvement with each other, it will come from learning how to voice discomfort without turning it into a verdict. Only then will connection feel like it's worth investing in again. If you enjoyed this video, you might enjoy the Why Gen Z is Terrified of Intimacy video, which ties in kind of heavily to this, but it focuses on the fear of getting into a romantic relationship. I hope you enjoyed this. Let me know your thoughts in the comments, and I'm going.